Welcome to our video on ADHD and medication. As a parent, it's natural to have questions and concerns about your child's diagnosis and treatment options. In this video, I'll be addressing some of the most common questions parents ask me about ADHD and medication. From side effects to treatment options, we'll cover it all. One of the most common concerns parents have about ADHD medication in general is the potential side effects. Common side effects of ADHD medications include decreased appetite. Many ADHD medications can suppress appetite, leading to weight loss or slowed growth in children. Difficulty sleeping. Stimulants can interfere with sleep patterns, making it hard to fall asleep or stay asleep. Anxiety or jitteriness. Some ADHD medications can cause feelings of anxiety or jitteriness, especially in people who are sensitive to stimulants. Headaches. Headaches are a common side effect of many ADHD medications. Stomach upset. Nausea, vomiting, or stomach pain can occur when taking ADHD medications. Another question I get is, what are the different types of ADHD medications? Well, there are several types of ADHD medications available, including stimulants, non-stimulants, and antidepressants. Stimulants. These medications work by increasing the levels of certain neurotransmitters such as dopamine and norepinephrine in the brain. Examples of these medications include Ritalin, Adderall, and Vyvanse. Non-stimulants. These medications work differently than stimulants and can take longer to start working. Examples include Strattera and Intuniv. Antidepressants. Some antidepressants, such as Wellbutrin, can be used off-label to treat ADHD. Some parents ask me, how do ADHD medications affect brain development in children? Well, many parents worry about the potential long-term effects of these medications on their child's brain development. But research shows that ADHD medications are generally safe for children's brain development when used as directed. However, more research is needed to understand the long-term effects of ADHD medications on brain development. Regular monitoring by a healthcare professional is crucial to ensure that the medication is working effectively and safely. Sometimes parents ask, what is the best way to support my child who has ADHD? While medication can be effective for ADHD, it's essential to remember that it's just one part of a comprehensive treatment plan. A comprehensive treatment plan should include behavioral therapy, such as cognitive behavioral therapy, or CBT, which can help your child develop skills to manage their symptoms. It should also include lifestyle changes. Encourage healthy habits such as regular exercise, a balanced diet, and sufficient sleep. And medication. Medication can help alleviate ADHD symptoms, but it should be used in conjunction with behavioral therapy and lifestyle changes. And then finally, support and education. Educate yourself and your child about ADHD and provide emotional support and encouragement. Another common question I get is, will my child have ADHD their whole life? Well, ADHD is a chronic condition, but with the right treatment plan, your child can learn to manage their symptoms and improve their quality of life. ADHD symptoms can change as your child grows and develops. With the right treatment plan, your child can learn to manage their ADHD symptoms and improve their quality of life. Some parents also have concerns about how they can explain their child's diagnosis to their child, friends, or family. Explaining ADHD can be challenging, but it's essential to help them understand and support your child. You want to use simple language, focus on strengths, and also educate others about ADHD. Now, what are some of the benefits of ADHD medication? Well, some benefits include improved focus and attention. ADHD medication can help your child stay focused and be attentive. Medication can help your child control impulsive behaviors. ADHD medication can help your child complete tasks and assignments more efficiently. Some people ask about dependence and addiction. Stimulant medications can be habit forming, especially when used improperly. Combination therapy usually involves medication in conjunction with therapy. It's often the recommended approach. This approach can lead to better health outcomes for your child and help your child develop skills to manage their symptoms. Parents also wonder how long will their child need to take ADHD medication. The length of time your child needs to take ADHD medication depends on each child's response to medication, which is unique, and some may need medication for a bit longer. It also depends on the severity of the symptoms. Children with more severe ADHD symptoms may require medication for a longer duration. And another question, are there any alternative treatments for ADHD? Yes. Behavioral therapy such as CBT can help your child develop the skills to learn to manage their ADHD symptoms. Some alternative therapies such as neurofeedback and cognitive training may also be helpful in managing ADHD. Research does consistently show that stimulants such as those used to treat ADHD can improve cognitive function in several areas. Improved attention control. Stimulants help individuals with ADHD focus their attention, ignore distractions, and switch between tasks more efficiently. Many of my child's patients tell me that the ADHD medication quiets their brain so they can tune out all the extra noise that is occurring. Enhanced vigilance. Stimulants can improve an individual's ability to sustain attention over a prolonged period of time. It can also improve working memory. Stimulants enhances working memory, which is essential for learning and for academic performance. Some studies suggest that stimulants can improve episodic memory, which involves recalling specific events or experiences. Stimulants can also help with ADHD by developing better planning and organizational skills. It can improve an individual's ability to regulate their emotions, motivation, and behavior. And it can also help people switch between tasks much more efficiently. Some studies suggest that stimulants can improve problem-solving skills, particularly in tasks that require creative thinking. It's essential to note that individual results may vary. The cognitive enhancing effects of stimulants can vary significantly between individuals. The optimal dose and duration of stimulant treatment can impact cognitive outcomes. Stimulants should only be used under the guidance of a qualified healthcare professional to minimize potential risks and side effects. Overall, the research suggests that stimulants is an effective treatment for improving cognitive functions in individuals with ADHD. That's it for today's video on ADHD and medication. I hope you found this information helpful in understanding your child's diagnosis and treatment options. Remember, every child is unique, and what works for one child may not work for another. Work with your child's healthcare provider to develop a comprehensive treatment plan that meets their individual needs. Thanks for watching.